Hi, I'm Ron Kine. This week we passed a budget to keep the government functioning through the remainder of the year. But also this week a larger conversation has begun on how we can best address the long-term structural budget deficits, the type of investments I believe we should be making to grow our economy and create good-paying jobs while being fiscally responsible at the same time. I was very disappointed to see the details of the Republican budget that was released. They're calling for dismantling Medicare as we know it today, forcing seniors into the hands of private health insurance companies and expecting them to pay double the amount of out-of-pocket expenses for health care coverage in the future. All for the sake of trying to deliver continued tax breaks to wealthy Wall Street bankers, to big oil companies, and to multi-billionaires. In fact, what they're asking is for 33 seniors in western Wisconsin to pay an additional $6,000 a year out of their pocket for their health care so President Obama can still receive a $200,000 tax break. I think that's wrong. I'll do everything I can to preserve and protect Medicare and Social Security, making sure that we live up to the promise of our seniors while reforming these vitally important programs so we can afford them for future generations. I believe the best way of doing that is by changing not only how health care is delivered in our society, but how we pay for it. So it's based on the value or the outcome of care as opposed to the volume of care. We're spending close to 1 out of every 3 healthcare dollars on tests and procedures that don't work. They don't improve patient care. That's almost $800 billion a year that we're not getting a good bang for our buck. That's where we should be focusing on if we're going to be serious about deficit reduction. Getting a better investment from the healthcare dollars that are being paid, whether it's in Medicare or private health plans. We all have a stake in this, rather than forcing seniors into the private marketplace, when the very reason Medicare was created to begin with is because private health insurance companies do not want to insure seniors. They're not profitable. As we get older, we consume more health care. That's why I think the Ryan or the Republican budget proposal is doomed for failure. Instead, we should be investing in the future of our country, education and workforce development programs, the expansion of broadband to every inch of our territory, vital scientific research, and the infrastructure investment we need to sustain a growing economy with good-paying jobs. All of those programs are slated for drastic budget reductions, but that's not where the money is. The largest and fastest growing area of spending is rising healthcare costs, so we have to address that. We should also address the excessive waste that exists in the defense budget with outdated weapons programs that our Pentagon does not want and say they don't need anymore, or the cost overruns of many of these weapons programs, where today they're $300 billion over budget. And I will continue to lead the fight on Farm Bill reform so we can end the huge taxpayer subsidies that are going to a few but very large agribusinesses that are not helping our family farmers back home and are not fiscally responsible. There's a way of doing this while protecting important programs that people rely upon today, but also finding the needed cost savings in the future. I'm dedicated to working on that, finding a bipartisan solution, and the common ground that I know exists when it comes to addressing seriously, finally, these budget deficits that we're facing as a nation.